Friends, if you are a beginner in the Ayurvedic practice, a fresh graduate, but you are very much perfect with the clinical diagnosis, but still you are not finding the medication to be prescribed to the patient, and because of you feel discouraged or lack of confidence, then I have got a story to share with you. When I was just doing when I was in my internship, and I was working concurrently as assistant to my teacher, and whenever he used to be absent, I used to attend the clinic, and in his absence I was supposed to take the history of the patient, and then I should share it with the sir, and then the medicine should be prescribed as per his instruction. But many times the situation will be like that, where sir will not be available on the phone, because way back I am speaking about in the year 1999, when mobiles were not there. So in that time, I used to stuck regarding the medicines, what means planning the treatment. I used to take to the examination. I used to arrive to a provisional diagnosis, but still I was not able to prescribe the Ayurvedic medicine to the particular condition of the patient. So I used to feel guilty about myself that I am not able to prescribe the medicine for the patients. And being an Ayurveda graduate in the internship, of course, that was I. You may say that it is too early to feel guilty because you are in the internship, but no. Academic 4.5 years, the valuable 4.5 years of our age, we have invested in that, and because of the lack of focus in the curriculum, lack of seriousness about the profession, and lack of what you call the commitment to learn the things, and lack of discipline to adopt the professional what you call the skills, that used to make me feel guilty. And because of that, I went to my teacher and confessed that I am not able to plan the treatment and I want to quit this particular profession. I want to change the profession because I am not able to do the justice with my patients. I don't have any right to continue this profession. This was my confession in front of my teacher. And my teacher, who has taught me the Ayurveda only by Guru Dr, okay, he told me that, dear Vivek, when I completed my degree, even I was not able to do the clinical examination and find the provisional diagnosis. And whatever I learned in my post graduation, and I adopted the same. And it's never too late to learn. And at least you have realized this. And this is not the answer to quit the job or the profession, rather. It is to learn every day, because medical profession is learning every day. It will be always trial and error basis. On that you are supposed to plan your treatment. That's why the experienced doctors are highly placed, above placed, rather than compared to the junior doctors, only because of this, because they have learned many of the things during their clinical practice outside the college classroom, and they have come to made a conclusion. That's why the experience is valued. And he told me that a simple tip he gave to me on that day, that is what I am going to share with you people now, that if you are stuck anywhere, anytime, to decide the Ayurvedic prescription or the medicine, and fortunately most of the patients which are coming to you, they will be of chronic disease only, okay, so there is no life threat for the patients. So you have got ample of time, at least 1 week of time, because 7 days supposed to be given to the drug to act, okay. So minimum 7 days window period is there where your drug is going to act, and you prescribe the drug whatever you feel at that time. Go back to the classics and take along with the history of the patient, then make your research and find out what the medicines you have prescribed, whether they are right or not. If they are right, continue with that. If they are wrong, change it when the patient comes after 7 days for the follow-up. And what is supposed to be prescribed on the first day when you don't know what is supposed to be prescribed. So simple tip is that you prescribe Agnidipaka, Amapachaka, Vatanalomaka, because 90% of the patients will be coming with the Sama Lakshanas. And of course, if you go to the Vatavadi Chikitsa of Sushruta, he says that Shadharna Yoga should be prescribed on the first instance before going for the other medications. So that is what he gave to me, the golden nugget. Based on that, I made my clinical practice, that is always Samavastha should be cleared, then the main treatment will be acting, and that 7 days should be used for clearing that Sama or the Ama Lakshanas and Amavastha of the body, and definitely you'll get the result. And meantime, do the research, and every day it is learning, and don't get disheartened because you are not able to prescribe the medicine. You'll be able to prescribe, and you'll be in a better position to prescribe the medicine if you have got that commitment, and if you have got that what you call the interest and the responsibility to treat the patient through Ayurvedic medicines. And that is what, go ahead, try to prescribe Ayurveda medicine, okay, and definitely you will get the mastery within 6 months to 1 year in particular disease, okay. And that's why narrow down your niche, try to focus on one disease per year. Okay, another teacher, he used to tell me that he used to practice, he used to focus on particular disease for whole 1 year, and he used to do the research, all the things, required research, and based on that he used to get the mastery on that. So these are the two golden nuggets what I wanted to intended to share today. And have a good day, and thank you for watching this video.